Dr. James Bogash, expert in health and longevity, and today we're going to talk about something you might not want to hear about, and that has to do with the potential dangers of tattoos. And we're not talking about hepatitis B or an infection, we're talking about something a little bit more sinister. But before we do that, make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel. So that being said, the results of this study are not a terribly big surprise. The problem with the internet and medical literature is you can go down some rabbit holes. And I had a patient who had laser tattoo removal, and I was like, I know that the skin doesn't just slough off, so what happens? Well, it turns out that the laser breaks down the particles into smaller amounts so that what can happen? That's where the big question comes. This particular patient had a really bad inflammatory reaction, and as I went down this rabbit hole, it turns out that these particles are just broken down to be taken away by the lymphatic and the immune system. But these are dyes that the body sometimes can't get rid of, and they are chemicals that can create a chronic inflammatory scenario, and that is always a bad condition and a recipe for potential cancer. So sure enough, in this study done Danish, I think it was out of it was a Danish study. The Danes are in, I don't know, I'm blanking right now, but Northern Europe. It was a twin study looking at almost 2,400 twins and the risk of getting certain both lymphoma and non-basal cell carcinoma, so other skin cancers. And don't ask me why they didn't consider basal cell carcinoma, and what they found that the risk was definitely increased. Now the numbers were still small because it wasn't common, but there was definitely some pretty strongly increased risks in those twins in the study who had a tattoo, both on lymphoma and on non-basal cell skin cancers. Definitely something to consider, and it shouldn't come as a big surprise. There's also some concern, maybe fast forward we'll have some more information, but like red inks may have, especially the ones that are made out of the azo dyes, and these are coal derived. You then expose them to sunlight, and that can create some more problems. Again, laser tattoo removal may end up just creating this really bad scenario, inflammatory scenario, with all of these particles being distributed through the body and collecting in the lymph nodes. So that would make sense that lymphoma might be on the list. Now, the larger the tattoo, much greater risk. That may be just more ink. That probably makes the more sense. More larger tattoos, you're going to have more ink that's potentially exposed to. It also means that tattoo removal probably is not a very good idea. That means make those tattoo decisions smartly and not on a drunken whim in Vegas at 1 o'clock on a Saturday night. But again, this is just, it's one single study, but it does make sense that exposing the body to these dyes over time can create some problems. Now, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.